Hello, my friends. I'm Dr. Elena Molisheva. Today, we will talk about 3 simple tests that can save your life, especially if you're over 50. Imagine you're walking through a park in Moscow, enjoying the fresh air, but suddenly you feel tired, short of breath, and your head seems foggy. You think, is it just age? But no. It could be a hidden problem that can easily be detected with simple tests, even available for free in any clinic. If you don't check in time, you might face serious risks without even realizing it. Before we begin, please take a second to like this video and subscribe to the channel. Thank you so much. Tell me in the comments where you're watching from and what time it is there. Now let's start our journey together. Today, we'll go over 3 key tests: a complete blood count, a biochemical blood test, and an iron metabolism test. These tests help identify problems that are often invisible, especially in people over 50. Let's begin with a complete blood count, focusing on red blood cells, erythrocytes, and their indicators. Why is this important? After 50, our body becomes more vulnerable. According to the World Health Organization, about 20% of older adults suffer from hidden anemia, which causes fatigue, weakness, and even memory decline. Let's see what the complete blood count tells us. The first important indicator is hematocrit. It shows how thick your blood is, the ratio of blood cells to the liquid part, plasma. If hematocrit is high, it may indicate dehydration. For example, you don't drink enough water, especially on a hot day in Moscow, or maybe you have an infection that causes fluid loss. High hematocrit can also occur with kidney problems or metabolic disorders like prediabetes. You'll be surprised to learn that, according to research from Harvard Medical School, high hematocrit can be an early sign of type 2 diabetes, especially in people over 50. If hematocrit is low, it may indicate anemia or chronic blood loss, for example, due to stomach problems. My advice: drink at least 2 liters of water daily, especially if you're over 50, to maintain normal blood thickness. Imagine Anna Ivanovna, 62 years old, who walks daily with her grandson but gets tired quickly. She thought it was age, but her test showed low hematocrit, and the doctor discovered hidden anemia. Simple changes in diet and water intake solve the problem. Many don't realize that such small things as lack of water can seriously affect health. The next indicators are erythrocytes and hemoglobin, but we'll talk about them a bit later. You'll be surprised how these numbers can save you from serious problems, so keep watching. Now let's move to other red blood parameters: erythrocytes, hemoglobin, and the mean corpuscular volume, MCV. These numbers help detect different types of anemia. Anemia isn't just weakness, it's a serious issue, especially for people over 50. According to the Mayo Clinic, the risk of anemia increases by 30% after age 65 due to poorer nutrient absorption. If erythrocytes and hemoglobin are low, that's a clear sign of anemia, but often it's hidden. For example, low MCV means smaller red blood cells, which indicates iron deficiency. One of my patients had low MCV even though hemoglobin was still normal. That's latent deficiency developing gradually. You'll be surprised to know that high MCV, above 93, signals macrocytic anemia, caused by a lack of vitamins B12 or B9. According to the Lancet journal, in older people this can be linked to chronic alcohol use, which interferes with vitamin absorption. Imagine Grandpa Piotr, 68 years old, who enjoys a small drink in the evening, not realizing it causes large, immature red cells, leading to fatigue and forgetfulness. My advice: include foods rich in vitamin B12 like meat, eggs, or fish, and check your vitamin levels. Many don't know that such anemia can be an early sign of neurological disorders. Another thing, if hemoglobin and erythrocytes are elevated, it could be erythemia, when bone marrow produces too many cells, thickening the blood. That's a risk of clots, especially in the elderly. Treatment often starts with bloodletting to thin the blood. Keep watching till the end. The part about white blood cells is crucial for understanding infections. Now let's move to white blood cells, leukocytes, which reflect the immune system's performance. After 50, immunity weakens, and according to the CDC, infection risk in older adults rises. Leukocytes include several types: neutrophils, eosinophils, basophils, monocytes, and lymphocytes. It's important to look at absolute numbers, not just percentages, because percentages only show ratios. If neutrophils are elevated, that means a bacterial infection. They are the first to respond, devouring bacteria. For example, after 3 to 4 days of high fever, a blood test will show whether antibiotics are needed. If lymphocytes are high but leukocytes are low, that means a virus, and antibiotics are useless. Pay attention to eosinophils, normal up to 3. If higher, it's allergy or parasites. Parasites often trigger allergies, especially in older people living in rural areas near Moscow. My advice: wash your hands often and check for allergies or parasites. Imagine Grandma Maria, 70, who complained of itching and fatigue. She thought it was dust allergy. But the test revealed parasites from her garden. That was an aha moment. Many don't realize eosinophils can uncover hidden infections that weaken the body for years. Next, platelets. These tiny blood elements are responsible for clotting. They react first to vessel damage, sticking together to stop bleeding. One of my patients had normal platelets, but if they are too low, there's a risk of prolonged bleeding. If too high, there's a risk of clots, especially relevant for those over 50. According to the American Heart Association, clot risk increases by 40% with age due to slower circulation and accumulated risk factors. I often use this marker to adjust omega-3 dosage, which thins blood and can replace aspirin for heart prevention. My advice: take 1 to 2 g of omega-3 daily. If platelets are above 150,000, that's safe and beneficial. Imagine Grandma Olga, 65, who took aspirin for her heart but had stomach issues. Switching to fish-based omega-3 improved her health with no side effects. Many don't realize that low platelets can lead to brain hemorrhage at 70, especially after falls, common among the elderly. That's an aha moment. A simple test can prevent a catastrophe. Next, ESR, the erythrocyte sedimentation rate, a nonspecific inflammation marker. It rises with bacterial infections when leukocytes and neutrophils also increase. ESR also goes up with rheumatoid arthritis if your joints hurt. Check this marker. According to the Arthritis Foundation, people over 50 have a high risk of arthritis, and ESR helps detect it early. For women before menstruation, ESR can rise to 20. Don't panic, just retest in the first phase. Tip: take tests on an empty stomach, after 4 hours without food, and get good sleep for accurate results. If your routine is irregular, take them as is, to see your real state. Now the second test, blood biochemistry. There are many indicators, but let's focus on the key ones. Start with liver enzymes, ALT and AST. They reflect liver function and signal cell destruction, cytolysis. These enzymes are intracellular, and their increase means inflammation, hepatitis or fatty liver disease. I often see high ALT in overweight patients over 50. According to the US National Institutes of Health, fatty liver affects 25% of older adults with metabolic syndrome and can lead to cirrhosis. If ALT is above 30, that's a red flag, especially if AST is normal. The problem is in the liver. If AST is high but ALT normal, check muscles, including the heart. Imagine Uncle Sergey, 55, overweight, who ignored fatigue, but high ALT revealed fatty liver disease. Timely diet changes prevented cirrhosis. You'll be surprised by what bilirubin can reveal next, even genetic secrets. Now, about bilirubin. It's a byproduct of red blood cell breakdown. They live only 120 days and are destroyed in the spleen. Bilirubin is toxic, and the liver processes it. Indirect, free, bilirubin turns into direct, bound, bilirubin, excreted with bile. Total bilirubin is the sum of both. If both total and indirect are high, it could be Gilbert's syndrome, a genetic feature where an enzyme works inefficiently. Studies show Gilbert's occurs in 5 to 10% of people, and in Russia, especially in the Northwest, it's even higher. It may appear late, after 50, triggered by stress, poor diet, or lack of sleep. Imagine a 60-year-old man from Moscow, overworked, suddenly noticing yellow skin and fatigue. The test showed high indirect bilirubin, genetics confirmed Gilbert's, and simple lifestyle changes, more sleep, healthy food, normalized levels. Many don't realize Gilbert's can wake up in adulthood. According to the European Journal of Genetics, it can cause brain fog and decrease performance. My advice: avoid stress, sleep 7 to 8 hours, eat foods rich in antioxidants, vegetables and fruits. If total and direct bilirubin are both high, that's cholestasis, bile stagnation due to stones or blockage. Low bilirubin means weak liver or slow red cell renewal, leading to hypoxia. Stimulate it with vitamins. Another liver marker, lactate dehydrogenase, LDH. Its increase indicates inflammation. Now about kidneys, creatinine and urea are protein metabolism products. High creatinine signals kidney failure. High urea, protein metabolism disorders or catabolism. According to the Kidney Foundation, Chronic kidney disease affects about 44% of people over 65, often due to hypertension or diabetes. Imagine a 65-year-old woman taking joint pills for years, unaware they strain her kidneys. High creatinine revealed the issue early, and corrections saved her from dialysis. My advice: eat less salt, drink enough water, check your blood pressure. This prevents rising creatinine. Many don't know that after 50, the risk of kidney problems rises 25 to 40% with age. Total protein shows protein metabolism. Below 73 to 75 means muscles, organs, and hormones suffer. Most hormones are proteins, like insulin or thyroid hormones. Alkaline phosphatase, if low, it's vitamin B6 or zinc deficiency, if high, cholestasis or osteoporosis. The third test, iron metabolism, iron, transferrin saturation, and ferritin. A patient may have normal iron and transferrin but low ferritin, 15, iron stores in the liver. Optimal for women over 50 is 70 to 80. Low saturation means deficiency, transferrin is empty, like a taxi without passengers. According to WHO, iron deficiency in the elderly is linked to osteoporosis and weakness. You'll be surprised to learn about high ferritin. This is crucial. If ferritin is above 150 to 200, it may mean hemochromatosis, a genetic condition of iron overload, or chronic inflammation, even cancer. According to Cancer Research UK, elevated ferritin in people over 50 often correlates with cancer, and early diagnosis saves lives. My father's ferritin kept rising, reaching 750, and only then bladder cancer was found. Fortunately, surgery removed the tumor, and ferritin levels dropped. Imagine a 70-year-old patient ignoring fatigue. High ferritin revealed hidden post-COVID inflammation, which research shows can persist for months. Many don't know ferritin is a marker of chronic inflammation. If it stays high long, search for the cause. My advice: never take iron infusions on your own with low ferritin. Consult your doctor, especially after 50, when deficiency is tied to osteoporosis. Add vitamin C for better absorption of iron from foods like spinach or meat. We've reviewed the basic tests: complete blood count, biochemistry, and iron metabolism. They are the foundation for health control to avoid serious diseases. There are also additional tests: vitamin D with parathyroid hormone, homocysteine, heart attack risk, lipid profile, atherosclerosis, thyroid panel, stool test, digestion, and urinalysis, kidneys. Details are in the file on my Telegram channel, link in the description. Download it free. In conclusion, these 3 tests are available to everyone, even free, and help people over 50 stay healthy. Compare your results, and if something's wrong, consult your doctor. Thank you for watching. If this was helpful, like, subscribe, and watch the next video. See you soon. Musical note.